Hello everyone, myself is Dr. Tejas Patel, Assistant Professor in Pharmacology. In this session, I am going to talk about Introduction to Adverse Drug Reactions. The learning objective of this session is you should be able to understand the different terminologies related to adverse drug reactions. We will start with this session with what is adverse drug event. Now, adverse drug event refers to any untoward medical occurrence that may present during treatment with a medicine, which may not necessarily have a direct relationship with the drug. So both direct as well as indirect consequences of the drugs are considered as an adverse drug event. Adverse drug event includes adverse drug reactions. So adverse drug reactions are a part of adverse drug events. Now, what is adverse drug reactions? Adverse drug reaction refers to any noxious change which is suspected to be due to a drug, occurs at doses normally used in man, which requires treatment, or decrease in dose, or indicates caution in the future use. In simple words, all adverse drug events which occurs at therapeutic doses and which is considered to be direct consequences of a drug administration is considered as an adverse drug reaction. For example, patient is having common cold and she took phenyramine, and we know phenyramine is a first generation antihistamine, so it likely to produce sedation, drowsiness, which is noxious response in this case, so considered as an adverse drug reaction. We also know first generation antihistamine impairs the psychomotor performance, impairs the reflexes. So if such patient gets accident after taking phenyramine and died, it is the extension of the adverse drug reactions. So it is considered as an adverse drug events. So in this scenario, both sedation, which is a direct consequences of the drug administration, as well as traumatic death, which is an indirect consequences of a drug administration, are considered as an adverse drug event, while sedation and psychomotor impairment is an adverse drug reaction in this case. Next important type of the adverse drug event is medication errors. Medication errors refers to failure in a treatment process that harms the patient or that has a potential to harm the patient. Medication error can occur at the level of prescribing of drugs, transcribing, that means communication, verbal or written communication errors, dispensing of a medication, administration of a medication, or errors into the monitoring of medication. Now, prescribing type of the medication errors that occurs because of the irrational and inappropriate selection of drugs. For example, we know common cold is a viral condition. So if patient is prescribed antibiotics, this is a case of prescribing type of errors. Then use of penicillin in known case of allergic patients is also example of prescribing type of medication errors. Second important type of medication error is transcribing type of the error. That is because of the error in communication. It could be verbal error or written error. We'll understand it with the example. If you use unnecessary trailing zero, for example, if you write 1.0 unit instead of 1 unit, so there are high chances patient may receive 10 unit instead of 1 unit. Then if you have a habit of not writing a leading zero, so if you write 0.2 microgram instead of 0.2 microgram, there are high chances patient may receive 2 microgram instead of 0.2 microgram. Another example is if you only write injection adrenaline 0.5 ml state, and if you do not mention the route of administration, so there are high chances instead of intramuscular adrenaline, patient may receive intravenous adrenaline. So these are all types of the error are considered as transcribing type of the error. Another types of the errors occurs at dispensing and administration level. That happens because of a sound-alike drug or look-alike drug. For example, bisacodyl and bisoprolol, pronounced similar. Carbamazepine and carbamazole, sound similar. So there are chances. Instead of bisacodyl, patient may receive bisoprolol. Another example is of the lookalike drug. Here the packages of gabapentin and gemfibrozil. Similarly, packages of sertraline and simvastatin look similar. So there are chances. Instead of gabapentin, patient may receive gemfibrozil if proper care is not taken. Now, the last type of the medication error is monitoring liver. If you have not habit of monitoring the renal or hepatic functions when it requires, there are chances. Patients with renal dysfunction may receive the full therapeutic dose of aminoglycosides and can have a nephrotoxicity, ototoxicity. Third important type of the adverse drug event is drug overdose. So that leads to the excessive pharmacological actions and toxicity. Drug overdose could be absolute or relative. Absolute means patient accidentally receive the overdose or receive it with a suicidal purpose. Relative means usual dose of a drug in the presence of hepatic or renal failure. Central nervous system, cardiovascular system, kidney, liver are commonly involved in drug toxicity. Imipramine causes cardiac arrhythmia in overdose. This is the example of cardiotoxicity. Another example is opioid analgesics causes respiratory depression in overdose. And fourth type of the adverse drug event is drug-drug interactions. Drug-drug interactions can occur at a level of pharmacodynamic or at a level of pharmacokinetic. If both drugs are acting through similar mechanisms, there are possibility of pharmacodynamic type of interactions. For example, excessive respiratory depression due to concurrent use of benzodiazepines and opioids. We know both are the CNS depressions. If both are used concurrently during anesthesia, so there are high chances patient may develop respiratory depression. So those patients may require respiratory assistance or ventilatory support. Another example is marked psychomotor impairment due to concurrent use of benzodiazepines and antihistamines. Then pharmacokinetic type of drug-drug interaction can occur if one drug inhibits the metabolism of other drugs and increases its plasma concentration. For example, sodium valproate is an enzyme inhibitor, inhibits the metabolism of phenytoin. Now both sodium valproate and phenytoin are the anti-epileptic drugs. So there are high chances patient may receive both drugs. In this scenario, sodium valproate can increase the level of phenytoin and can produce neurotoxicity. Then another type is non-compliance. So patient is not receiving the drug as per the prescription. So that can lead to the therapeutic failure. Another reason for the therapeutic failure is resistance in case of antimicrobial agents. Then drug-drug interaction can also lead to therapeutic failure if one drug induces the metabolism of other drug. For example, phenytoin and phenobarbital, both are anti-epileptic drugs. If taken simultaneously, they induces each other's metabolism and decreases the effect of each other. So adverse drug reactions, medication errors, drug overdose and drug-drug interactions are the types of the adverse drug events which is associated with the safety, while non-compliance and therapeutic failure are associated with the efficacy of the drugs. So adverse drug event is a broader terminology that deals with the all untoward incidences, whether related with the safety or related with the efficacy. Well, for the pharmacovigilance or adverse safety point of view, we are more concerned with the adverse drug reactions, medication errors, drug overdose and drug-drug interactions. Now we will understand the types of adverse drug reactions. There are basically two types of the adverse drug reactions, augmented type and bizarre types of the reactions. The augmented type of the reactions happens because of the extension of pharmacological actions or excessive pharmacological actions, while bizarre type of the reactions are not associated with the pharmacology property of the drugs. First we'll see type A or augmented type of the reactions. So generally they are predictable based on the pharmacological properties of the drugs, because they occurs because of the known action of the drugs. They are dose related, so on therapeutic doses or low doses they produce side effects, in overdoses they produce toxicity. They are usually preventable with appropriate selection of doses. So therapy is usually started with lower doses and we gradually increase the doses based on the patient tolerability. They are also preventable by taking appropriate precautions. For example, we know NSAIDs, aspirin, ibuprofen, diclofenac, all these drugs are known to cause gastritis. So we advise patient to take these drugs with a glass of water, or we prescribe gastric acid reducing agents like H2 receptor antagonist or proton pump inhibitors. They are more common because all drugs are likely to produce augmented type of reactions based on its pharmacological actions. And similarly, all patients are susceptible to this type of the reaction, depends on the doses they receive. They are usually less serious. They produce toxicity only at overdoses. Examples of type A reactions are atropine, an anticholinergic drug, produces dry mouth due to its anti-secretory action. Similarly, chlorpheniramine, first generation antihistamine, blocks H1 receptors in CNS and produces sedation. Glycerol trinitrate, anti-anginal drug, causes headache because of its vasodilatory action. Second type of the adverse drug reaction is bizarre type or type B reactions. So they are unpredictable because they are not related with the drug's known action or pharmacological properties. They depends on the peculiarity of the patient. So some patients are prone for the such reactions. They are not related to dose, so they can occur at any doses. They are mostly not preventable, particularly the first episode of the reaction. Subsequent reactions can be avoided by restricting the future use of the drugs. Examples of the type B reactions are all sorts of the allergic reactions are considered bizarre type of the reactions. They are less common and usually more serious as compared to type A reactions. I will see some of the examples of type B reactions. I have said previously, all sorts of the allergic reactions and idiosyncratic reactions are bizarre type of the reactions. Pruritus or itching, skin rash, fixed drug eruption, urticaria, angioedema are the commonly seen allergic reactions. While erythema multiforme, Stevens-Johnson syndrome, or toxic epidermal necrolysis, exfoliative dermatitis, laryngoedema, anaphylactic reaction is a rare but serious type of the allergic reactions. Then common causative drugs for the allergic reactions. They are the antimicrobial agents, non-steroidal anti-inflammatory drugs, and anti-epileptic drugs. Among the antimicrobial agents, penicillin, cephalosporin, sulfa drugs, and fluoroquinolones are commonly suspected for allergic reactions. But remember, these drugs can produce allergic reactions only in a small portion of population exposed to it, those who are susceptible to it, and cannot produce in other individuals at any doses. In few individuals, these drugs or its metabolites acts as an antigen and produce antibodies, and subsequently allergic reaction develops. Another important thing is one drug can produce different types of the allergic reactions in different individuals. Chemically related drugs often show cross reactivity. Now, cross reactivity is also one of the important factors. Some groups show complete cross reactivity, some groups show partial cross reactivity. A complete cross reactivity means allergic reaction to one drug, that means high chances of allergic reaction to other chemical related drugs. For example, if patient develops skin resist to penicillin G, there are high chances the same patient will develop skin resist with amoxicillin, because it's another penicillin group of drugs. A complete cross reactivity is more likely in case of the antimicrobial agents, while partial cross reactivity is seen in NSAIDs. So if patient develops allergic reaction to paracetamol, other NSAIDs can be prescribed to him, but under observation with due precautions. Some of the examples: ampicillin causes skin rash, sulfonamides causes Stevens-Johnson syndrome, aspirin causes anaphylactic reaction. Again, at the end, I will summarize important differences between augmented and bizarre type of the reactions. Type A reactions are predictable based on its pharmacological properties, while type B reactions depends on the peculiarities of the patients. Type A reactions are dose related and usually preventable with appropriate dosage selection, while type A reactions are more common because all types of the drugs can produce type A reactions, while type B is a rare ones. Type A are usually less serious, while type B in generally more serious than type A reaction. Thank you very much.